Okay, so this next video, this is a continuation from my last video. If you haven't watched that, you need to go watch that. That was on the origins of the DSM, how they even assembled the book that they have 370 mental disorders that when you go to see a psychiatrist that you are guaranteed to walk out of there with some highly toxic medication. I highly recommend you go watch that last video I just made. This one, again, is based off of the YouTube channel, Council for Evidence-Based Psychiatry. This Cliff Notes type of deal I'm doing here is based off the video of Robert Whitaker, Our Psychiatric Drug Epidemic. Again, he is this guy is an investigative journalist who was hired by a bunch of psychiatrists to do this work and find out exactly the history of what was going on and how this epidemic has come about. I will put the details for where you can go watch the video in the description of this video. Psychosis and schizophrenia are due to too much dopamine in the brain, and the drugs that they administer supposedly fix that issue. In 1987, we spent $800 million on psych drugs. Now again, these videos that I'm getting this information from were posted 7 years ago. So as of 7 years ago, they were now spending in the USA alone $40 billion, guys. You don't think there's a profit motive? In 1987, we were spending $800 million. Not even 97? About 30 years later, that amount increased 50-fold to $40 billion. This is all about profit. This is not about your health. This is not about your wellness. This is not about fixing you. And in fact, if you keep watching this video, I'm going to go over these cliff notes and you're going to see that these medicines are actually making your condition much worse. They would have you to believe that the reason for the uptick in the expenditure on these medications is due to advancements in medical science. If you watch the full video, it clearly explains to you why that is not the case. They did not study the brains of people with schizophrenia, psychosis, depression, etc. They study how the drugs act on the brain. This is a very important point. What they found was these antipsychotics blocked dopamine receptors. They literally said if we are lowering the uptake of dopamine, maybe schizophrenia is caused by too much dopamine. It's a hypothesis. The chemical imbalance theory has been proven false over and over and over and over again, yet they continue to administer these severely toxic drugs. The head of the National Institute for Mental Health stated in 2002 that there is no evidence that a lesion in the dopamine center is the cause of schizophrenia. The same goes for serotonin in treatment for depression and things like ADHD, etc. Investigators have found that psych drugs induce compensatory changes in the brain that create a chemical imbalance in the brain and of the type hypothesized to cause the mental disorder in the first place. Guys, I'm not going to keep repeating these cliff notes. If you have been diagnosed, if you are currently on medication, if you have children on medication, if you have children who are diagnosed, if you are thinking of getting diagnosed, you need to do yourself service and go watch all the videos. There's about 8 or 10 of them on the YouTube channel, Council for Evidence-Based Psychiatry. Okay, this is an actual council that a bunch of psychiatrists and investigative journalists put together called the Council for Evidence-Based Psychiatry to put this information out there. They only have 8 to 10 videos that were posted 7 years ago. Nothing prior, nothing since. These investigators have found that through continued drug treatment, may induce processes that are the opposite of what the medication originally produced. So what they were finding, see, now these studies, they've got, in these videos, they've got tons of studies throughout the decades that all kinds of independent medical practices have put together. And this is where this information comes from. So continued drugs, and what they have found out is that in people with schizophrenia and psychosis, the drugs in a 6-week clinical trials were outstanding. They were markedly improving people. But over time, over the course 6 months to a year later, completely different story. So this may cause a worsening of the illness, continue for a period of time after discontinuing of the medication, may not be reversible. In other words, coming off these meds is dangerous. It also goes into the reason and how they prove antipsychotics work in the short term as compared to the long term. After 50 years of anti-psych meds, okay, so these doctors, like one of the most highly regarded doctors in this field of research, said this: after 50 years of anti-psych meds, are we able to answer the following simple question? Are neuroleptics, which are antipsychotics, effective in treating schizophrenia? There is no compelling evidence on the matter when long-term is considered. Another quote by another highly regarded doctor: if we wish to base psychiatry on evidence-based medicine, we run a genuine risk in taking a close look at what has been considered fact. Meaning that the whole thing is a sham. Guys, go watch these videos. It'll make your stomach turn. National Institute of Mental Health did a study and found that in the 6-week study, there was an improvement in the antipsychotic group compared to placebo. However, the 1-year results showed that drug-treated patients had higher rehospitalization rates. Over 5 years, relapse rate is much higher and ability to function is much less. Much more, these people are much more socially dependent and much less likely to be working after 5 years on this medication, on these antipsychotics. So when they're promoting all this antipsychotic medication, they're like, look how great it works. It is all based off 6-week trials. And I think they even have now shortened that period to like 4 weeks, maybe less, because they're having to shorten it because the benefit as opposed to the cost ratio of this medication is extremely low. Clinicians state that their patients are getting better faster, but they're having to return for treatment much more often. It's called the revolving door syndrome, and the revolving door syndrome came out of administering these antipsychotics. That's literally how bad and how covered up this is. Relapse on the drug is much more severe than placebo. Drugs are exacerbating, oh man, this was sickening. So drugs are exacerbating the decline in the brain. The drug comes in, causes a morphological change in the brain, and it changes that happens, you're getting worse negative symptoms and greater cognitive impairment. So you have to stay on the drug. It's addictive. So you got to stay on the drug because what it's doing, wait till you guys watch the video, but it is actually what it is supposed to be helping with the schizophrenia and psychosis. It is actually exacerbating and causing an increase, over the years of the destruction of the brain. So again, this came from the video entitled Robert Whitaker, Our Psychiatric Drug Epidemic. I'm putting this out. This is extremely important information, guys. You need to go watch these videos. Not just these two, but the other 5 or 6 that they have posted. The Council for Evidence-Based Psychiatry is the name of the YouTube channel. But I'm going to put all this in the information. You guys need to do yourself a service. They're killing you. They are killing you. They're killing your kids. They're killing your loved ones. You need to go watch these videos.